what I wanted to do is take a little bit of time and talk about how COVID-19 has actually changed what we're doing in the mosquito control world. So definitely I wanted to extend a thank you to PVCA and the NEVBD for extending the invitation to speak. And for the next 15 minutes or so, I'm going to talk a little bit about what we've done during this COVID epidemic here and or pandemic that everybody's been experiencing. One of my responsibilities in the Office of Mosquito Control Coordination is, of course, coordinating. And what I did is I assigned one of my staff members to track mosquito control capacity. And we did that from the state commission interest perspective because programs, had been shut down when the governor had released their stay-at-home orders. And it all happened at a time, when we weren't doing a heck of a lot in the field from the mosquito control standpoint, but the season was fast approaching and we were not looking very good. In the very beginnings of this capacity analysis, we were only at about 20% of what we should have been. Okay. So my objectives, I'm going to touch on the timeline just to bring everybody back to, kind of when this first started and where we were at, what changed. I'm going to talk a little bit about the organization of mosquito control in New Jersey and how it's delivered. It's broken up into a bunch of different agencies. I'll touch on some of the approaches the various programs used to maintain mosquito control services, contrast some of the differences, what I thought worked really, really well and was novel, and, some of the stuff that was just, getting by. I will touch on the impacts that this has had on programs. Some of the challenges trying to coordinate activities has been. Something that's looming large right now are the funding challenges. And then I'll close with kind of what I think is coming. So with respect to the timeline, for us here in the Northeast, this COVID thing was getting a lot of attention during the NJMCA meetings. And that picture I'm showing you up here in the right-hand corner is literally our group shot of the New Jersey Mosquito Control Association meeting, right towards the end. At that point in time, New Jersey had experienced its first case. Late in the meeting, I think it was on that Friday, AMCA had made the decision to cancel their meeting. Shortly thereafter, the governor declared a state of emergency. We had about a week at the state where we were reporting to work, and then we actually went remote around the 16th of March. So really shortly after we came back from those meetings, we were out. And then the governor actually issued his stay-at-home orders the 21st of March. And by that time, there were 1,000 cases reported in New Jersey. And as those of you who were out trying to buy cleaning supplies and all that, there was a run on them. The shelves were bare, and I don't know why toilet paper goes during these things, but it was hard to find. As were paper towels and the hand sanitizers and all of that stuff. So that's kind of where we were. So it was the very beginning of March, and then by mid-March to the end of March, people were out. So for us, what changed? And to be honest, pretty much everything. How we went about doing our work changed dramatically. I'm just showing you an image of, the schools were empty. Kids were asked to stay home. The superintendents were busy trying to plan how they were going to maintain essential operations while properly socially distancing, while making sure that the staff that was reporting had a clean work environment. Additionally, they were dealing with the individual needs of the staff. Any individual with a particular health issue got some consideration. And then the staff that had kids that were at home and needed some help with the schooling, time for that as well. So very, very challenging from that perspective. When we first went out, the duration for how long we were going to be out was literally unknown. The discussions around our tables in the state offices, well, definitely a couple of weeks, could be a month. Some are saying it could last, into June. So that's kind of where our mindset was at the time. Now, bear in mind, while everybody's trying to come up with these plans, these program directors at the county levels were working remotely, sometimes juggling the teaching needs of the kids while they were trying to figure out what their staff was going to be doing and who should be reporting to the office and who didn't need to. So, with regard to organization, mosquito control in New Jersey in 1912 was set up as autonomous mosquito commissions. Since that time, there's been a number of changes. Some have turned into departments themselves or work within a department in an agency or something along those lines. So the organization kind of varies dramatically. And the mosquito control situation that each program was dealing with was very different. So initially, some of the programs literally just shut down. Employees went home. They were told that we will let you know what's going on as soon as we can figure that out. For some of the other programs, it didn't change a whole heck of a lot. They had a lot of essential employees. Public works departments are a pretty good example of that. They're used to coming to work, when the county is closed, so to speak. With respect to the commissions, those autonomous bodies, they had the flexibility to kind of set their own policy, which I think was very handy because it was very mosquito control oriented. Those that were established and working in departments largely followed whatever the department was going to be doing at that time. So they didn't have to make those decisions. They pretty much waited for what those decisions were going to be, and then had to take the various accommodations in mind based on the staff that they had working with them. Now, a lot of these differences with respect to who was coming to work and who wasn't coming to work had a lot to do with the county facilities that were available for these staff. So if you had a lot of space, you could have more people coming in. If you didn't have a lot of space, you had to come up with some other means of meeting your mosquito control needs. Okay, so again, I touched on this a little earlier. Some programs literally just shut down. And what you had was some administrative staff that were working remotely, maybe 1 or 2 days a week, trying to put all this stuff together. We had other programs that went to rotating schedules. Half of their staff would be reporting one day, the other portion of the staff the next, and that varied considerably. Some were every other day, some were every other week. Some went to rotating 2-week shifts. Again, making special accommodations for staff that needed those accommodations. Some programs had folks that would come in 2 days 1 week, and then the next week they would come in 3 days, and vice versa. And that's kind of how they managed that social distancing. In the programs where everyone was working, some of these were kind of interesting. Some of those folks were working remotely, some were reporting, some were going directly out into the field. So they were given a vehicle, they could take the vehicle home, and then they would just go out to the field, do the work, and then report back to home. For the programs that needed to share resources, what they were doing is they would report directly to the vehicle, which was at work, then head out into the field. Then when they came back, the vehicle needed to be sanitized for the next individual that would come in, and then wind up using those resources. And if you remember, early on in this pandemic, there was recommendations with respect to the use of face coverings. And they were hard to come by, and they were pretty much being reserved for your first responders and medical people in the very beginning. And if you tried to buy them, they were, if you didn't already have them, they were pretty hard to come by. I think I placed an order in April and it didn't come in till the end of June. Okay, so some of these differences. Again, I kind of touched on this earlier. The commissions were probably the most flexible. They adapted relatively quickly, with perhaps one exception. And they were able to make their decisions based on what the most efficient mosquito control needs were. When you got into the DPWs, it was a little more mixed. Some of these programs just plowed forward. People came in, they were essential employees, they were used to it, and they literally just got it done. They did what they needed to do to make sure that those services were provided. In others, the staff were actually diverted off to assist with the COVID pandemic. In those cases, mosquito control was more on the back burner. It wasn't, in the active season yet, so they kind of grabbed those staff members and had them working, assisting, setting up testing stations, things of that nature. With respect to our health departments, the majority of those also had their mosquito control staff diverted off to assist with the COVID pandemic in some way. Eventually, as the season, fell upon us and the active mosquito breeding was happening out in the field, nearly all of the staff were returned back to the mosquito control programs. So in the end, things, worked out, but it was dicey for a while there. So what were some of these impacts on the programs themselves? Well, the early season field work was just simply delayed. The people weren't there. Some of those broods came off. When the programs were coming back, they found themselves immediately in catch-up mode. We wound up just fortunately having a really odd spring. It was a little colder than normal. We weren't seeing the mosquito populations that we had over the past 5 years or so. So again, welcome, a little surprising. We'll take a good long hard look at the data we collected to try to figure out exactly what was going on. Lots of meetings were canceled. All of the in-person meetings, by and large, were just canceled. Those that we decided to have, we were moving over to this virtual setting, and there were technical difficulties for any of the programs that weren't used to meeting in that format. Some of the folks fell into it fairly easily. It was a little bit more challenging. Perhaps a little bit more significant from the operations standpoint were the programs that had staff that were looking to come on. There were hiring freezes, so you weren't allowed to bring on your full-time staff, and it kind of made sense. Why would you hire somebody that you're just going to pay to stay home while you're trying to figure out what was going on? But it extended to part-time staff, temporary staff, and seasonal staff. So some of those things got started very late. We had lab supply shortages. It was really hard to bring on what we needed when we needed it. So that led to the decision to delay the start date for our mosquito testing. Now, it turns out we started, on what would be a normal date because we were planning to start 2 weeks earlier. We had similar issues with the start of the traditional vector and adult mosquito surveillance programs. They too wound up starting a little later than they normally would. And of course, when you're making all of these different arrangements, who's going to come to work, when they're going to come to work, there were all sorts of staffing issues and human resource issues that the program's directors had to deal with. But the reality is we have adapted, and things are running relatively smoothly right now. So from a coordination standpoint, in New Jersey, really lucky. Fortunately, we meet a lot. We continued our meetings, although none of them were in person anymore. They were all on a virtual platform. But we had the opportunity to share what we were doing, the decisions that were coming down. We benefited from the information that was shared, and we tried to get the most out of our workforces that we could. And this is where I got a lot of the information with respect to what was our capacity. Should something happen, what kind of situation were we in as a state to deal with the mosquito population? We certainly didn't want to be dealing with two crises at the same time. So we made decisions to assess what the laboratory supplies were and then just distribute them to the counties that needed them. Some counties actually shared some of their supplies with the other programs that actually needed them. Again, fortunate we had a really slow season. That helped on a lot of fronts. We did have storm-driven rains and activities. We had some power outages, and we had nuisance populations that were experienced as a result of that. I noted earlier that disease activity so far has been fairly mild, so very welcome on that front. What I have noticed is the virtual meeting conflicts are numerous, and administrative processes delays are just unavoidable, and we're still suffering through some of those things. With respect to funding, the state revenues, what they're bringing in are way down. The State Commission had big plans to increase their funding. We were looking to double our funding resources. That wasn't really an option in this current year. We did make it through FY20 with the resources we had. It was really tight, but we made it. We weren't sure we were going to. And the state did see budget shortfalls. Around $7 billion, I think, was what we were looking at for FY20, and it's supposed to be a little bit more than that, you know, for FY21 that's coming up. That was just a result of the money coming into the program just wasn't there. July, incredibly difficult from the state perspective because we went through state furloughs, and then the state actually borrowed some money, and that was all designed to prevent layoffs. So July was tough. This FY21 is going to be difficult because our funding resources are level, which is good, but they weren't sufficient in a normal year. So FY21 should be interesting. The county budgets, they're starting their processes now. I expect to see challenges on that front as well as we move into these winter months. So it's going to be interesting to see how all that winds out. So my prediction, you know, if I could have a little crystal ball and look through it, I don't mean to be a downer here, but from a COVID standpoint, it's not looking that good. Trends across the country look like they're picking up. Do expect this situation that we're in right now to, you know, persist through the winter and probably into the spring, and possibly even a little further, depending on how things work out. One of the things we brought up a few months ago was the need to address indoor air handling. If you're going to bring your staff back safely, that's something, especially with these virus particles being aerosolized now, is something that programs are going to have to deal with, and that could be expensive depending on what the current situation is. On the brighter side, this virtual setting and this remote work, by and large, is working. And I do expect some of this may become routine for some of the positions within the mosquito control community. Some individuals, they literally work more efficiently remotely, at least a few days a week. I can see that becoming kind of sort of routine. And I do expect our state to adopt some policy along those lines. The DEP in general is very pleased with productivity of staff in this remote working environment. So that was kind of it, short and sweet. I think we're going to be dealing this for a while, and fingers crossed, but hope this pandemic ends relatively soon. With that, Ray, I think I will hand it back over to you.